Hi, have you heard of the saying, if you treat a cold, it will last for 14 days. If you don't treat a cold, it will last for 2 weeks. Welcome to Baby Child and Co. Once again, today we are talking about common cold. It is so common that it is called common cold. That means that every parent has experienced it at least once, but more likely multiple times. Every child gets a cold. Have you already subscribed to this channel? If not, please subscribe. Visit our blog, babychildandco.com as well. When you do, please join the parenting club. Follow us on Facebook as well. So we said we are talking about common cold. So that is the cold, the running nose that our children get. Even adults get it. Sometimes it's accompanied by a cough. Sometimes they may have a slight fever. That is, they are hot. If you touch them or if you use a thermometer, they have a slight fever. They may be restless. They may lose appetite because often when you have a cold, you have some body aches and also you don't smell the food. And if you don't smell food, it's usually not so appetizing to you. So they may lose appetite. They may not eat well. They may be fussy and so on and so forth. Normally, common cold is caused by viruses. So viruses are these group of organisms that ordinarily the body takes care of them. They are not treated with antibiotics. If you needed to treat them, you needed to treat them with what we call antiviral drugs. But with common cold, the body usually takes care of it, and there is no need for any treatment. That is how come the saying, whether you treat it or not, it will last 14 days or 2 weeks, which are the same anyway. So, common cold usually does not need any treatment. Your body, the child's body, will take care of it. It's usual to have repeated bouts of common cold. In fact, every 1 to 2 months, a child can get a cold. So sometimes it seems to the parents as if the child is always having a cold, but that's not it. Usually one cold resolves, and then in a few days or a few weeks, the child gets a cold again. This happens in younger children, especially when they start school, but as they grow, they build immunity to most of these organisms and they don't get colds as frequently, or even when they do, the colds are not as bad. I have already said that most colds do not need treatment. So what do you do for your child when he or she has a cold? I said that sometimes there may be some muscle aches, you find your child not so active, and there may be a fever. So for that one, you can use paracetamol. But you need to watch for the dose because the dose is based on the child's weight. Sometimes when we don't need the weight, we don't know the weight, we can use the age to approximate, but the best is the weight. So you need to cross-check the dose when you purchase it over the counter or from the pharmacy. Sometimes the child's nose is blocked. So at home, our parents would put a towel in warm water and make us inhale the steam. It gives relief of symptoms, but you need to worry and be careful about burns because you can accidentally burn your child. The hot water can pour on your child when you do this. So yes, it relieves the symptoms. Just be careful when you do it. And then there are other home remedies. Some people use honey, some people use ginger. Honey is not to be given to any child who is less than 1 year old. So that is also a note of caution for you. Sometimes these home remedies are so pungent. When we blend garlic and ginger and many things together, they are so pungent that the child does not want to take them. And the parents may, in a desire to do something to help the child, want to force these things down the child's throat. But that is not to be done. I've said it in other videos. When you force feed your child anything, that thing can go the wrong way and can give your child serious problems that are even more serious than the cold you are trying to cure. We also do not like to give cough syrups to small children. So when the cold is accompanied by a cough, if you are thinking about purchasing a cough syrup for a very, very small child, usually a child less than 3 years, kindly cross-check with your healthcare provider. Aside these things, your child just needs a lot of attention, a lot of care, may need to stay out of school, may need to stay in bed until the child recovers. So these are the things that you should do. And I've already mentioned a few things you should not do. Don't force feed. Be careful your child does not get burnt. You should also not purchase antibiotics over the counter and give to your child who has a cold. Please don't. If you think your child is severely ill, before you purchase antibiotics, kindly cross-check with your child's healthcare provider, because I've explained that colds are usually caused by viruses. Usually, there are some bacteria that cause colds anyway, but cross-check so that we do not abuse our antibiotics. And then, so when do you need to go to hospital with a cold? When your child is breathing rapidly, is struggling to breathe, is breathing and is noisy, when your child is vomiting everything, when your child will not eat anything at all, then you need to take this child to hospital. Or if your child's color is changing, you need to take this child to hospital, because that is a cold that must be treated. Either it's gotten complicated or it's caused by some serious bacterial infection. So that cold needs to go to hospital and have it treated. So if you have questions or comments, kindly leave them for me. And subscribe. Hit the notification button as well. Find us on Facebook. Also visit our blog, babychildandco.com. Thank you so much for watching. See you next time. Bye.